Good evening, folks. Now, for discussion D, we are discussing how cannabis can help end of life pain for folks. So, here we go with the presentation I made for you. Sit back and enjoy, please. This narrative essay deepens the emotional, clinical, and human dimensions of how CBD, dominant cannabis, combinations with low dose THC may ease end of life agitation in dementia, softening neuropsychotic distress, preserving connection, and offering a greater alternative to heavy sedation. Cannabis combination eased end of life aggression in dementia patients. A narrative essay. Aggression advanced dementia is one of the most devastating forms of suffering witnessed in medicine. It is not simply behavior, it's a form of communication. Raw, urgent, and wordless. When language dissolves and memory fractures, aggression becomes the body's last vocabulary, a clenched jaw, a sudden shout, a restless pacing loop down the hallway. Each is a message from a mind struggling to interpret a world that no longer makes sense. Families describe these moments with a kind of helpless grief. They watch someone they love, someone who once told stories, cooked meals, laughed easily, now trapped inside a storm of fear, confusion. Clinicians see the toll as well as caregivers. Injured during resistiveness care, nights fractured by pacing, shouting, the patient's face tight with distress. Aggression is not loudness, it is suffering. For decades, the medical response has been shaped by necessity. Antipsychotic drugs, benzodiazepines, sedatives, tools that quiet the body by dimming consciousness. These medications can reduce agitation, but often a steep cost. The patient becomes drowsy, disconnected, unreachable. Families describe this as a second loss. She was still alive, but she wasn't there anymore. In the final chapter of life, when every moment of presence feels precious, heavy, sedation can feel like a thief. In recent years, a different possibility has begun to emerge. Small studies, caregiver reports, and early clinical trials suggest that cannabis based combinations, especially CBD dominant formulations with low dose THC, may ease aggression or agitation without erasing wakefulness. The evidence primarily, but the stories are starking. A man who had been pacing for hours sits calmly beside his wife. A woman who resisted every caregiving tasks allows her daughter to brush her hair. A patient who had been awake all night finally sleeps and wakes gently, not startled or confused. These moments matter. They are not cures, they are connections restored. The lived experience of agitation and the relief that followed. Agitation in dementia often arises from sensory misprocessing. A shadow becomes a threat. A caregiver hand becomes unfamiliar. A hallway seems endless and frightening. The patient cannot explain what is wrong, so the body speaks instead through pacing, shouting, shrieking out, or restless movements that seem to come from nowhere. Families who witnessed improvements with cannabis combinations often described a describe a shift that feels both subtle and profound. The patient is not sedated, they are not out of it. Instead, they seem less frightened, their movements softened, their eyes track more steadily, they tolerate touch, they allow care, they rest. One caregiver described her mother's change this way. She wasn't drugged, she was just herself again, calmer, not fighting the world. Clinicians echo these observations. They note fewer episodes of resistfulness to care, less nighttime agitation, and more predictable sleep wake cycles. Importantly, they describe preserved interaction, the ability to engage in familiar routines, enjoy rituals, listen to music, or simply sit with loved ones without distress. In end of life care, preserved interaction is not a luxury, it is the heart of dignity. Why cannabis might help. The endocannabinoid system regulates mood, sensory integration, sleep, pain, and neuroinflammation domains profoundly disrupted in dementia. CBD appears to reduce anxiety, inflammation, while low dose THC may support relaxation and sleep. In initiation, together in balanced formulations, they may dampen the hyperarousal that fuels agitation. This is not about intoxication. Is it it is about modulating distress. High dose THC can worsen confusion, which is why the emerging evidence points towards CBD dominant combinations. These formulations appear to offer comfort without cognitive disruption, easing agitation while preserving the ability to interact. The goal is not to quiet the patient, the goal is to quiet the suffering, comfort without erasure. Perhaps the most meaningful aspect of cannabis based combinations is what they do not do. They do not erase the patient, they do not silence the final opportunities for connection. They do not replace agitation with un- unconsciousness. Instead, they create space for families to sit together, for caregivers to provide care safely, for patients to experience their final days with less fear and more peace. A daughter can sit beside her mother and hold her hand without fear of being struck. A spouse can play familiar music and see the patient relax rather than startle. A caregiver can provide care without resistant restraint or distress. These are not small things. They are the essence of human end of life care, a cautious, hopeful future. The evidence is still early. Studies are small. Dosing varies. and long term safety data are limited. Cannabis is not a cure for dementia, nor a universal solution for agitation, but the consistent signal reduced stress or distress with preserved interaction invites careful, thoughtful exploration. As stigma fades and research explains, cannabis based combinations may become part of more humane toolkit for end of life dementia care, a tool that does not silence the person but supports them, a therapy that does not erase consciousness but erases suffering, a way to help the final chapter unfold with gentleness, dignity, and connection. The quieting, how cannabis combinations are easing end of life agitation and dementia. The storm at the end of memory. In the final stage of dementia, agitation often arrives like weather, sudden, unpredictable, and overwhelming. Families describe this Families describe it as a storm inside the person they love. A mother who once hummed while folding laundry now paces the hallway for hours, her hands trembling. A father who taught his children to fish now shouts at shadows only he can see. A spouse who shared decades of quiet routines now recoils from touch, unable to recognize the hand reaching toward him. Agitation is not misbehavior, it is fear made visible when memory dissolves and language slips away. The world becomes unfamiliar. A caregiver's hand feels strange. A familiar room looks wrong. A hallway seems endless. The patient cannot explain what is wrong, so the body speaks instead through pacing, shouting, striking out, or restless movements that seem to come from nowhere. Clinicians know this suffering intimately. They see the toll on caregivers, the sleeplessness or the sleepless nights, the injuries during resistiveness to care. They see the patient's face tighten tight with distress. They see families grieving in real time. And for decades, the medicine response has been shaped by necessity, antipsychotics, benzodiazepines, sedatives. These medications can quiet agitation, but often by dimming consciousness, they may silence the distress, but they also silence the person. Families call this the second loss. She was still alive, but she wasn't there anymore. A gentler possibility emerges. In recent years, a quieter, more surprising possibility has begun to take shape. Early studies, caregiver reports, and small clinical trials suggest cannabis based combinations, especially CBD dominant formulations, with low dose THC may ease agitation without erasing wakefulness. The evidence is still early, but the stories are compelling. A man who had been pacing for hours sits calmly beside his wife, his breathing steady. A woman who resisted every caregiving tasks allows her daughter to brush her hair. A patient who had been awake all night finally sleeps and wakes gently, not startled or confused. These moments matter. They are not cures, they are connections restored. The science behind the softening, the endocannabinoid system regulates mood, sensory integration, sleep, pain, and neuroinflammation, domains profoundly disrupted in dementia. CBD appears to reduce anxiety, inflammation, while low dose THC may support relaxation, sleep, and intonation together in balanced formation.